My objectives are many. Some of them have been covered, so we'll try to move right along with that. But I really want to review the heart of the matter here, which is this community assessment, which all of you should have a copy of our preliminary report. I want to discuss how we came about this, how it was analyzed, what we're hoping to achieve by it, and to really talk about some of the relevance and the economic impact as well as the social impact, and some of the solutions that we're already working on, and we hope that through the breakout set you will also give us some more input. The Multicultural Health Institute, of which I'm executive director, has three main parts to its mission: for research, education, and dissemination of information on multicultural health issues. And I think that it's been a wonderful journey and an interesting opportunity for the Multicultural Health Institute to partner with Genesis and several of the other organizations in this activity. And to give you a little more about myself, in my studies at Georgetown, we had to take courses in theology and philosophy, and I was very taken with the works of Paulo Freire, who did something called liberation theology. And he did a lot of work in Central America and working with the poor people. And his first book, which most people are very aware of, is entitled Pedagogy of the Oppressed, because he was actually in education. And in his work in education, he began to work to empower people and to give them the skills to determine their own destiny, as it were, and actually began to change entire healthcare systems. He then wrote another book called The Pedagogy of Hope, which is where we're at today. And I think it's very important because without hope, we are hopeless, and we cannot begin the struggle to change. And that hope must be rooted in practice. And like, what are we doing? Not just the struggle, not just the fighting, not just complaining and saying we have a problem, but what are we going to do? And because if there's inaction, you just have hopelessness and despair. But if you have something that's taking place, like if you get a bad diagnosis, you can sit around and complain to your friends, or you can go and get as much information and do what the doctor says and try to be as well as you can. And so in my work with the Multicultural Health Institute, we very much believe in the importance of empowerment medicine. And this is a way that we can build hope and build capacity in a community by doing these assessments, by collaborating with the Health Council and the Community Health Action Team and building partnerships. And in that way, we can hope to build effective relationships amongst different groups, many of whom may not necessarily get along. But if we work towards the common goal of the better health of the community, we can find a way to do that the best way that we can. Edna's already mentioned about the Institute of Medicine's report, which is really critical. This was a major landmark to state publicly, nationally, that we have a problem in the rates of medical procedures defined by race and ethnicity. Even when we're not worried about how people are going to pay and what their insurance status. That means there's an institutional and intrinsic process problem that has to be addressed. And in getting the information to you and to your friends and your families, this helps you to learn how to advocate for yourselves more effectively despite those realities. When we talk about perceptions and realities, and you're working with all these different groups, you have the perception from the policymakers and the people from the Department of Health and the universities and the people studying these things. Then you have the people that are, the patients, my patients that come into the office, the people at church, the people living this that everybody's studying. For example, there may be physical structures, there may be entities and things that the policymakers say, well, this is here, they've got that. But if the reality is people are underutilizing it or they don't know about it, then it's not as effective as it could be. And we need to find out why and what are some of the barriers, as were mentioned by Ms. Apostol's presentation. Is it a cultural issue? Is it the people don't speak the language? Is it not accessible because they have to cross 301 and they're walking? Is it off the bus line? Is it not in hours that people can access? So in putting together this team and in working together to empower a community, this is how we can achieve social justice. And we can begin to deal with these health inequities, which really are what health disparities are all about. And we're talking about issues of income and issues of access and issues of insurability. And so to do that, we have to bring together all different members of the community to begin to address the problem, to hear everyone's input and not just have a top-down theoretical assessment of the problem and say, well, we're going to do this and fix it for y'all. We have to have everybody's input to decide what's going to really work the best. So in taking this approach, our methodology included very much grassroots assessment, really trying as much as possible to go to the community You can see it's hard to, even though we're having this right here in Booker, right in the middle of Newtown, and it's a Saturday morning, it's hard to get people to come to big things. It's intimidating. But if we go to them, if we go to the church groups, if we go to the little civic groups and we hang out at the park, which is what we've really done, we can get people's input, and that's what we really wanted to do. And we can also create partnerships and find out where can we go to get information and give information. And I want to talk about how we incorporated our Gatekeeper project into this, which allowed it to be much more effective, I believe. There is a lot of history with regards to community assessments. I'm not going to stand here and say I just came up with this great idea on my own and we're just making this up. I mean, there's a lot of precedents that have been done nationally. I was in California for many years. There's some great projects that have been done and use this type of information to help define their policy. Many of the benefits from community assessments are that they can identify the key health problems as perceived by the inhabitants of the community. They can identify the healthcare needs and provide objective information to assess where are the strengths and weaknesses in the health delivery system. And also can provide recommendations for how we can best target the needed prevention and detection and treatment and follow-up strategies, and therefore improve our strategic planning as a community and as a county, a city, etc. I was recently at the Cancer, Culture, and Literacy Conference sponsored by Moffitt Hospital in Clearwater, and Dr. Dressler made an excellent presentation there about the integration of culture and how people perceive themselves, like what defines a community or defines a family, and the importance of the degree to which people feel connected to one another has actually been measured objectively and can be translated into levels of high blood pressure, levels of control of cholesterol and diabetes. It's really amazing work. And I think that the more we can show the good parts in the community, the resources, the more we can build on that, and that's important to do. He also showed in his studies that it's very interesting the way that you approach different things. For example, if you approach certain healthcare initiatives not from a biomedical model, and this is a bad thing and it makes people feel bad about themselves, but more on a feel-good model, that you get more of a buy-in from people. And so it's kind of how you sell your healthcare is also very important, and he talked about that. And when doing community assessments, and in doing this one in particular, we went and got community input. We started to do some data collection. We had focus groups. We created a preliminary survey. We refined that. We did presentations to different groups, and we are working towards a final report. The report that you have here is a preliminary summary. We were urgently trying to get something together in time for this conference, and it's really compelling, the data that's here, but it is still in need of further refinement, and we want to include the interactive input as well. I think most of you know about our demographics here in Newtown, that it's a really interesting area because it's so concentrated in African American population as compared to the general Sarasota city and county population, which is 95% Caucasian. So it makes for a real interesting comparison when you evaluate the subpopulation. You see these incredible disparities in the rates of different diseases, as have been mentioned before. As a result of this, the Newtown Health Advisory Council was formed about a year ago. And it is a collaboration of a variety of entities, but our main focus is on how we can impact the health issues that are affecting Newtown. And it's formed of a broad spectrum of leaders. We welcome anybody else who may be interested who's here today to be a part of the council and give input. Our main strategic vision was to empower the community, strengthen and integrate healthcare services, and create resources for accountability and continuous feedback on the factors affecting the residents. So as I said, we had some preliminary focus groups last spring, which brought up real issues of concern in access, education, and lack of infrastructure. This led to the creation of an initial report based on some of the focus groups that we had, and in that, it was brought up the need to have better transportation, the need for more education, a fitness gym, these types of things. And we presented this at the front porch and other meetings, and they agreed that we need to proceed with this project. We built the group, we had collaboration with a variety of entities, developed and refined the instrument, and began dissemination of the surveys. We have, thus far, about 311 responses. And we worked in collaboration with various universities in the area. What was really unique, I think, was the pairing of the survey distribution with the Gatekeeper program. This is a lot of work because there were so many areas of interest that we wanted to cover that the surveys themselves, it's a lot of work to do the surveys. It takes a real initiative to want to complete the survey, and we had to have people could work with people to encourage them to do that. The gatekeepers were set up as part of the Silence to Death initiative to address HIV and AIDS last year. And we created a cadre of people that have helped us to define sites within the community to do testing and to heighten visibility for HIV and AIDS, which we've talked a little bit about here today in terms of disparity. As a result of this program, we had 40 people trained in specific HIV/AIDS outreach, counseling, and testing. And I'm happy to report today that we are going to complete the distribution of our 40,000 condom as part of our 40,000 condoms in 40 days initiative. And I think we should give the gatekeepers a round of applause for that effort. It's been amazing. And we are also working with some friendly churches to continue some outreach activities. So the importance of this is that by having the gatekeepers, people from the community who know the community, they can help us to access information to the community and get information as well. We have different activities like this activity today, the diabetes fair, the wellness group, whatever is going on, gatekeepers are now ever present, and they're out there at the grassroots level working with people. Now this interim report, which you all should have, right now I think we're at 60 pages, the recurrent themes that we found were really interesting. Over and over again, it was always a theme of the problems with transportation, access to providers, scheduling of services. For people who are working, it's really hard to take off work, as was mentioned. There's very few places where you can go after hours and not have to pay a pretty high fee if you're paying for your services. There's very few places open on Saturday. There's a need for communication, for more education, and more culturally sensitive provider interactions. I get calls all the time, or I see patients very frequently for issues that really aren't germane to my practice. They're really more a matter of helping them to understand what the other